And I think this slide does a good job of just showing you, here's the different types of channels that we typically see in healthcare being utilized, some much more than others. And obviously, when we think about that funnel that we just talked about, a big decision point in your outreach strategy is what channel makes sense for the communication that you're sending. We know that adding an additional channel, so going beyond just a single channel of an outbound call or a letter, depending on the type of outreach, can drive another 20 to 50% additional engagement. Because again, you're really just working hard to meet people where they are and on the preferred channel and mode that they want to be communicated with. So, for example, if you're going to be delivering some sensitive information about a plan update, maybe a warming letter goes out prior to a phone call to make sure that folks really understand it and are really engaged. And of course, cost obviously plays a role here. And you can see in this table, we've summarized some of the costs as well as the coverage potential and effectiveness. But we're going to talk a little bit more about choosing the right channel and then measuring to make sure you're seeing those outcomes over time. And again, specifically, Drew's got some great insight into print and how to maximize that as well. But a multi-channel strategy should be designed to connect your outreaches across modes. So if it's an administrative and health communication across multiple communication platforms, even let those must mails, we call them. So it's a mandated letter that has to go out, for example. Let those must mails do double duty. And Drew's going to talk through some great examples. So if you're going to be sending out a must mail letter from an administrative perspective, make sure that it also is distributing a new ID card, or utilize that outreach to drive pharmacy steerage, maybe increase brand to generic conversions, have folks register on a portal. There's lots of different ways that you can maximize an outreach. You want to make sure it's very member centric and that you're measuring it. And so I'll give you another example for another client. We were able to actually reduce the overall number of member pharmacy communications that were going out because we made sure each touch point that did go out the door had more value. And what happened that was surprising actually was that by reducing the number of communications that went out and reducing the touch points, members saw more value in them. Probably not a surprise, but we were surprised how quickly it happened because members quickly realized, oh, wait, this isn't a throwaway letter, or this isn't a throwaway phone call or email. This is important outreach now. And I need to be more engaged. And we saw call to action responses really grew even into year 2. So making those touch points more valuable is critical. And Drew, back to your earlier point, doing that with a lens of already understanding what's going out across the enterprise is really important.
Yeah, and I think also to your point on the last slide, which I know we're going to revisit, but these different modalities have a different cost, and I think it's a double-edged sword on the cost of digital messages becoming so low, and we've kind of become drunk on saturation of, well, we can send out an email to a member every single day. It requires internal restraint and internal governance. Again, going back to that word of saying just because we can, does that mean we should? It's sort of a false indicator of we're communicating with the member because we're blasting things out. It's a really different proxy than we're driving effective messaging. And I think that's what we're going to get into in terms of, are you measuring what happens on the tail end of those communications? Because the bounce rate matters, or the efficacy of actually taking a requested action, that matters. And so I think that's where we're also seeing a lot of organizations having to kind of revisit their methods from the last 5-10 years, where they've become increasingly reliant on send a lot of really inexpensive communications, and recognizing that in some instances can be doing more harm than good.
Absolutely. I think, definitely speaking to the fatigue that people feel again when they're receiving just the abundance of messages coming in across channels. So ensuring that you're maximizing that touch point is so key.